What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for October 5, 2020. More COVID-19 mental health questions. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, for our Friday question and answer episode, Stephanie Desmond gets answers to your COVID-19 mental health questions from Laura Murray, a clinical psychologist at Johns Hopkins. Let's listen.
Laura Murray, thank you for joining me. Welcome back to the show.
Thanks so much. It's great to be here, Stephanie.
As you know, we have listener questions to ask this week about mental health. And the first one actually is really just for me because I don't know if our listeners know, but you live in Houston, Texas, which is seeing a huge spike in cases, almost as large, if not larger, than New York City saw at its peak. And so I'm wondering sort of what the mental health challenges are of living in a state where cases are spiking.
Yeah, it's an interesting time to be living in Houston, Texas, for sure. Stephanie, I think the best way to answer that is there are a lot of decisions going on, both personal and professional, because we went from lockdown to really opening up to back to sort of a level 1 lockdown. I think mental health affects seeing a large rise in anxiety from some people as the threat increases. You do hear a lot that some people are just fatigued. They want it to end. I'm tired of going back on lockdown, sort of that framework. Lots of things are still open though. So lots of restaurants and camps and things are still open. So I also think it's hard for a city to go from open to back to shut down where we went in about a week's time. So really, it's a hard place for leaders. And when I say leaders, I mean of organizations, families, parents. There's just a lot of tough decisions. And I think people are getting a little mentally fatigued with having to just make these day after day.
And you did talk about sort of the many decisions to make. With the risks so high, I imagine that people who are appropriately concerned, that makes it even more challenging.
Yes. Yeah. And frustrating too, Stephanie, I think for those that are concerned, and especially those, as we've talked about before, where they may have a family member that they're taking care of that's more elderly or has pre-existing conditions. So I think that good decision-making and problem-solving skills are so essential right now. And those are things that we don't come by naturally. They have to be learned and honed over time. It's not something you're just born with. And I think that that's really something that people can be focusing on is what are my decision-making and problem-solving skills? And this is where I think even people that are good at it are feeling a little bit fatigued of constantly going through this.
So we have a question about sort of the psychological impacts on kids, on younger kids who missed school and now aren't necessarily going to camp. They sort of have nothing to do. On college kids who, are now back home with mom and dad and, aren't sure they're going to get to go back to the campus life that they were experiencing. So talk to me about that. What can we be done for kids?
Yeah, gosh, I have to say, Stephanie, I feel for these college kids that are were living with their friends, having a great experience and coming back home. That's just such a big social and psychological adjustment to shift that. So just starting with college age and the psychological impact, I think there's a lot of frustration and just trying to manage such a drastic shift in their life plan, which is a really big thing to wrap your head around cognitively. this is where my life was going. This was my major. I was living with my friends, et cetera. And now to universities saying we may not come back for another year. They may not see some of their friends for a long time. So lots of worry and concern too that we're hearing about graduation. And are they going to stay on the same track? Is this going to put them behind? All sorts of worries and concerns there. So how do we help that sort of age range? One, I really encourage parents just to have a lot of communication going on in the family and try to actively listen. What are you worried about? What are the questions you have? And if you're not very comfortable with your teen or young adult, or they're not very comfortable with you, these are things you can write down also. Or even as a parent, you could say, if I was in your place, these would be some of my worries or concerns that I would have living back with my parents. Because I think for those of you guys out there that are parents, you can resonate with this a little bit of how we might feel if we had to move back in with our parents after being at college. And I think that's really helpful for these students to hear. And then working back to problem solving, really trying to lay out what is the problem? What's our goal? What are possible solutions? Choose one and test it out so that they feel like you're actively trying to work through their situation. When will graduation come? What's the plan, etc. Shifting to younger kids, and we've talked a little bit about this in some different episodes on this podcast. I think younger kids are looking for that structure. And that's what they need. That's what they do well with. So in the absence of schools and camps and other things that we might do, really try to create some structure for them. So get them on a project or get them on certain things every day they know they have to do between certain hours with free time in between. Seeing lots of things about just getting back to how we used to play in previous generations where we didn't have camps and we didn't have sort of other things. What can we do that's still safe? And then as far as what to do with them too, couldn't say this enough, strong communication, really sitting down and just listening to your kids and asking them questions that I think sometimes are hard for us because we're in that same position of, what do you think about this whole COVID thing now that we can't go outside or we can't go visit grandma and grandpa or, you can't see your friends as much? Because the more open we are, the more that we're able to mitigate any possible mental health effects.
I have a middle schooler, a high schooler, and a college student living in my house. And so I really feel it on so many different levels myself. And, it's really hard. I find a 13-year-old is having a really hard time with anyone trying to set sort of a schedule for her, and I'm trying to get actually her and her high school brothers, like, what is something that we could do that would be helpful in the world? So we do a little bit of volunteer work, but really it's very hard to keep them on a schedule when we all know it's artificial, right? So,
right.
So she was actually just last night telling me this whole long story about what they do at camp on the weekends. And it was very regimented. And if I tried to sort of bring that into our life here, she would have none of it. But let's move to another question. So we have a question here about sort of working at home. And I know that the question is really about sort of, some people feel like they're working all the time, which is really hard because they're working at home. But at the same time, they don't want to complain because they actually have jobs and a lot of people don't. And so sort of unpacking that is, I guess it's similar probably to advice that you would give to other people who have always worked at home and sort of creating boundaries. But I'm curious sort of your take on how we can deal with those emotions.
Yeah. Well, as you were talking about your kids and asking this question, I've been reading a lot more on just reframing and how neuroscience is just exploding with how much impact we can have on our lives. And so much of our lives are about how we frame the situation. What question are we even asking? And that's something that I have found very helpful for myself. Even though we know all these skills, we don't necessarily do them. And they're hard to keep up day after day, especially with COVID. And I'm at home with kids also who are bored or not wanting too much structure, et cetera. But I do think that one thing is to be very aware of how you're framing things, right? So if your computer is in your room and it's constant and you're working, being aware of that is always the first step, because that allows you to sort of step back and say, okay, what are my off hours? What are the days that is, or hours or weeks that I'm just not really going to touch this? I think that we've had to be more critical about that, in the sense of, for example, you might set a timer now, whereas before you didn't need to, where you really are watching your time and how much you spend, and reframing different situations. Like, even though this weekend is, I have X, Y, and Z to do, and I'm lucky to have a job, it's still really important that I take care of myself. And so reframing it constantly and through a lot of practice is really important. But I'm not going to lie to everyone. I mean, it is really hard. People with jobs are having to work around the clock and manage kids and manage sort of unstructured time, while at the same time being very aware that, as you said, very blessed and lucky to have jobs, because so many people are hurting in that way.
I also had another question here about social isolation. So there are people obviously who live alone, and some people haven't seen another person really in person for months now. How do they keep going?
Yeah, oh gosh. Going and feeling okay, right? I mean, one of the biggest impacts we have seen, especially with those that live alone, is high levels of depression, even thoughts of killing themselves. So I think this is back where your decision making might come into, and the level of openness and things. When you make decisions, there's uncertainty, there's complexity, there's high risk consequences, there's alternatives, and then there, of course, interpersonal. How are people going to respond and react? And I think keeping those in mind is really important when you're living alone, because you may need to go see a person, preferably not in a high risk situation. But I think that's really important to start working in. It is not healthy to sit by yourself for 6 months. And now that we all know we're sort of in a long term game here with COVID, we really want to be aware that that's not a long term solution to just stay by yourself. And so that might be some problem solving that you want to do. What are some things I can do to actually see a person, talk to a person, and actually physically get some contact without being high risk? So it may be that you expand your circle to a few people and just try to do activities outside with some social distance or something. But I do think it's important at this point for people that live alone to go beyond just the phone calls and the FaceTime. I think it would be really hard for someone to have good mental health without some human interaction.
Mm-hmm. And that's something that we're all afraid of in many ways.
Yes. Yeah. And fear is fear is such an interesting topic right now, because it's something that has kept us alive as a species, as human beings, and yet it can hinder so much of our lives. And so that's where you go back to that reframing and really thinking through that. What exactly am I afraid of here? Because if we just talk about it as I'm afraid, or fear sort of as a big topic, it tends to really impact our behaviors in more of a negative fashion. Whereas if you break that down a little bit, what exactly I'm afraid of? I'm afraid of going into an indoor restaurant with large numbers of people without masks. Then it's more manageable. And so I really encourage people. I think it's such a great word you brought up, Stephanie, because I think fear is at the bottom of this in so many ways, that we're fearful and we don't like someone else's decisions and behaviors. And that really is rooted in fear, but often expressed in anger.
Well, Laura Murray, thank you so much for joining us again.
Yeah, thank you so much for having me, Stephanie.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.